Right now, our Congress in the US is trying to pass through a bill that will track, monitor, and quarantine anybody that has coronavirus. But how accurate are these tests? The Tanzanian president was reported on last week that he had been sent many of these tests, but instead of listening to the World Health Organization, he tested animals, fruits, and vehicle oil instead of his citizens. He labeled these tests with names, genders, and age, and remarkably, a papaya, a quail, and a goat had been found positive of being with COVID-19. So the tests that will determine if we are forced to stay home or not are bringing back false positives on fruit and goats. So does this sound like a very solid test that we should be basing our entire health policy on? And now that you know that, we should continue on to seeing what the H.R.6666 Trace Act states. And it says, the Secretary of Health and Human Services, acting through the Director of the Center of Disease Control and Prevention, may award grants to eligible entities to conduct diagnostic testing for COVID-19, to trace and monitor the contacts of infected individuals, and to support the quarantine of such contacts through mobile and health units, and as necessary, testing individuals and providing individuals with services related to testing and quarantine at their residence. Since they're acting through the CDC, I think it's also important that we go and look at their recommendations for this TRACE Act. And the CDC states, contact tracing is a part of the process of supporting patients with suspected or confirmed infections. In contact tracing, public health staff work with patients to help them recall everyone with whom they have had close contact during the time frame while they have been infectious. Public health staff then warn these exposed individuals of their potential exposure as rapidly and sensitively as possible. To protect patient privacy, contacts are only informed that they have been exposed to the patient with the infection. They are not told the identity of the patient who may have exposed them. Contacts are provided with education, information, and support to understand their risks, what they should do to separate themselves from others who are not exposed, monitor themselves for illness, and the possibility that they could spread the infection to others even if they themselves do not feel ill. Contacts are encouraged to stay home and maintain social distance from others at least 6 feet until 14 days after their exposure, in case they also become ill. They should monitor themselves by checking their temperature twice a day and watching for cough and shortness of breath. To the extent the possible, public health staff should check in with these contacts and make sure they are self-monitoring and have not developed symptoms. Contacts who develop symptoms should promptly isolate themselves and notify public health staff. They should be promptly evaluated for infection and for the need for medical care. So this Tracing Act is supposed to control the pandemic, but in order to do that, they need to track, monitor, and log everyone. This is extremely illegal, and it basically takes a crap over the entire Constitution. They're essentially saying they need to test everyone and lock them in their houses if they test positive. But as we know, the tests themselves are not very reliable, and if you've seen my previous videos, you would know that the California's antibody tests show that 50 up to 80 times more people could have the coronavirus. And this makes total sense because as I have said before, that we have over 380 trillion viruses in us, and once we get a virus, we essentially store it in our virus banks in the virome. And if your immune system is working properly, you probably won't ever have symptoms, just like the flu, just like polio, and just like measles, or any virus for that matter. And as the CDC states, they don't even have to tell you who you came in contact with, just that you may have been exposed. Do you see how this could be used by thousands of corrupt government officials, police officers, and bureaucrats? So after they track you down and test you, if you have COVID, they'll lock you down in your home, which you are very likely to have because most people who get coronavirus have no symptoms. And because of the Tanzanian president, we know that these tests are not infallible. So how do we know if they're being completely accurate if these tests themselves can find COVID in fruit? This is a law that's designed to control an entire population, and it's being spearheaded by the CDC. You know, The CDC that recommends you to drink fluoride so you don't get cavities in your teeth. The CDC that recommends formaldehyde and mercury for toddlers so they don't get the flu. They're now recommending the federal government should know exactly where everyone is, exactly who they're talking to, and giving them the power to lock down any person in their home that has COVID. So excuse me if I'm extremely skeptical of a bureaucracy that recommends poison to all of us and our children, that are now recommending complete knowledge and control over the entire country's movements. Can you not see where this could possibly go wrong? Can you not see that this is a massive breach of our civil liberties, the Constitution, and basic human rights? Do you honestly think they are going to use this just for coronavirus patients? Like, maybe they will for now, but what happens when this is all over and they're still tracing everybody? If you look back through history, you can see that every time there's a state of emergency, the laws that were put in there to protect us never go away. They stay there afterwards, and it's probably by design. And so will they be using this newfound unlimited power over the entire country for good? The bill is literally called the H.R.6666 Tracing Act. They could have chosen any number they wanted, which is why I'm calling it Satan's mandates. And I recommend everyone go to the CDC and read their recommendations for the Tracing Act. There's some other creepy stuff in there about how they're talking about how they need to do it all right away, or focus on multi-generational households, even though they probably have already passed on all the viruses they have had to everybody else in the house. And so they go on to say that they want to merge all this information with our technology. And it states, case investigation, contact tracing, and contact follow-up and monitoring will need to be linked with timely testing, clinical services, and agile data management systems to facilitate real-time electronic transmission of laboratory and case data for public health action. Technology partners are key in the modification of existing systems and development of new user-friendly data interfaces to manage multiple data streams with seamless interoperability. Case management tools can help automate key pieces of the contact tracing process, making the overall process more efficient. Ideally, data systems would also include automated reports to aid in monitoring progress and outcomes of contact tracing. Data sharing agreements between local, tribal, and state and federal jurisdictions need to be established for augmented to ensure timely and accurate data collection and sharing. The adoption of emerging technologies that can assist private and public health practitioners with the client communication, medical monitoring, and strategies to amplify contact tracing may greatly help with scaling up the contact tracing as needed. Which essentially means they're going to mix all this data with our modern tech companies like Google, Apple, Microsoft, and Facebook. Automating exactly where we all are and what we're doing is an absolutely horrible idea. This is exactly what they have in China. The government there can find any citizen in the entire country in 3 seconds. Is that what we want in our country? Because if it is, you can kiss your rights, your way of life, and any essential freedoms you might hold on to, because this is the beginning of a massive surveillance state that is being implemented all over the world. It's not just happening in the U.S. This bill isn't law yet, but people like Governor Andrew Cuomo are already implementing this practice in New York. He says that he will have between 6,400 and 17,000 tracers in the coming weeks. New York has had the worst case numbers and deaths than anywhere in the country. Could this be because he intentionally put people infected with COVID-19 in nursing homes? Or that forcing everyone inside away from sunlight and vitamin D, which is an antiviral hormone, is the opposite of what the states should have done? Or maybe shutting everything down, scaring the hell out of everyone, and losing people their jobs and livelihoods is extremely stressful, and has been shown that stress is detrimental to the immune system. These officials do not care about us. They're doing what they're doing is not based off of the modern understanding of the immune system, and instead of supporting our health, they are destroying it. If you saw my other video, you would know that they are inflating the death rates and incentivizing doctors to label someone as COVID and putting them on ventilators. And to me, it seems like Governor Cuomo intentionally put infected people with COVID in nursing homes to increase the death rate so that he would have an excuse to implement this tyrannical Trace Act. Which, if you look back through history again, you can see governments have manipulated people during times of fear to give away their rights in exchange for protection. But we don't need their help to protect us. 66% of people hospitalized in New York were people staying at home. Go outside and get vitamin D. Start taking supplements and eating better. Make sure you have a strong social circle and you try and keep your stress levels down. And finally, make sure you're paying attention, because the government officials, people at the CDC and the WHO are not looking out for you. They are only there to poison, manipulate, control, and to find ways to get you to give up your rights enshrined by the Constitution. Fear is the virus, not COVID. And the sooner we realize that, the sooner we can stand up to these people and tell them no, because this Trace Act is just the beginning. And the only way we'll ever be able to get them to stop interfering with our lives and civil liberties is to take a stand. And like Benjamin Franklin said, they who can give up essential liberty to obtain a little temporary safety deserve neither liberty or safety.